patient is Josh Brown, male, and he has no allergies. So I will be giving insulin, heparin, the hepatitis vaccine, and Lovanex. And my blood glucose is 273. So I'll be giving 6 units. So I'll be giving regular insulin. Okay. I'm giving heparin. My heparin, I need 5,000. Oh, here it is. So I'm using the 10,000 units per 1 ml. So I'll be giving half of this since I only have 5,000. And then I have the hepatitis vaccine, 0.5 ml. And this is a Hep V vaccine, 20 micrograms. And then Lovanex is the 40 mg over 1 ml, and I need 20, so I'll be giving half. So I'll be giving half of heparin, so I have 10,000, half of the hepatitis vaccine, and half of the Lovanex. So, since I'm going to give them half, I'm going to get 3 1 mLs. So I can give, because they're all less than 1, I'm giving half for heparin, half for Hep B vaccine, and half for Lovanex. And then for my insulin, I'll be using, since I need 6 units, that's less than 100, I'll be using the 50. So it says half ml. And then now, for my gauges, I'll be getting the 25 gauge. The heparin is sub-Q, so I'm getting the 25 gauge 5/8. And then I'm also getting the, so I'll do this in the deltoid. And then I'm getting the hepatitis vaccine. So for that one, I'm just going to give the 25 1-inch, since it's an IM. And then Lovanex in sub-Q, 25 gauge, and 5/8. Okay. So, I'm gonna get some alcohol wipes. So, I'm gonna wash my hands for 30 seconds. 1, 2, 30. I'm going to apply my gloves. Okay. Other one. Okay. So I'm going to start off with my insulin. Heparin, regular dose. So it's regular insulin. I got the regular dose. Before I start, get my needle ready. Now I'm going to wipe. One, 2, 30. Okay. So I'm going to uncap. And I need 6 units since my blood glucose is 273. So I'm going to do 6 units. So 5, 6. Okay. Now I'm going to inject that into my bottle, the air. And then I'm gonna take in 6. Okay, make sure there's no air bubbles. Okay, So I'm gonna have another nurse check what I have,
Okay.
what this is.
Okay, I see 6 units insulin arm.
Yes. Awesome. So now I'm gonna release it and I'm gonna scoop and then place. And now I'm going to write down, I have insulin, regular insulin. Today is the 10th first, and then it is 9:50 a.m. I'm gonna write down my initials, and it's 6 units. So I'm gonna put that on there. Okay. Next, I have heparin. I'm gonna wipe that. 25 heparin is sub-Q, so 25, 5/8 gauge with my 1. Okay. So I'm gonna do 1, 2, 30. Trash there. My cap. That's nothing. It's halfway. I'm going to make sure that it's locked into place. Remove the cap. Okay, so I need, it's 5,000 units, and this one is 10,000. So I need to get half. So 0.5. Inject the air. And 0.5. Okay. Air. So it is heparin. I'm gonna have another nurse check what this is.
Okay, it shows 0.5
Yes.
heparin.
Yes. Okay. So release. And now I'm going to have that steady, sweep, and cap. Okay. So this is heparin. 0.5. Okay. Next is the hepatitis vaccine. Oh, those ones I just did. Okay. So for this one, it is an IM. So for this case, I will be using a 1 inch, and I'm giving half ml, so I have a 1 ml. Okay. So I'm going to wipe 1, 2, 30. Okay, rinse that. Take this halfway. Make sure it's nice and tight. Okay. And I need 0.5. So 0.5. Inject that. And then get 0.5. One. Okay. So 0.5. I'm going to release that. Okay. Put that in. So this one is the pet vaccine. Let me actually put that in order. Pet vaccine. And then lastly, I have Lovinex. It's 20 mg and I have 40, so I'm going to give half. 1, 2, 30. Last one is 1 ml, since I am going to give half. Okay. So I'm going to screw that and make sure it's nice and tight. Okay. Release. I need half. Here's half. Inject. And then withdraw half. There is one little small bubble in the end, and the reason for that is to seal it in once I inject it. Okay, I'm gonna fix this, make sure it's stable. Inject. Okay. Alright, so now I'm gonna return my medications. And then the trash. Okay. Now I'm going to go visit my patient. Okay.
Come in.
Good morning. My name is Annabel, and I'm a student nurse from Nevada State College. Can I have you verify your name for me, please?
Sure. It's Josh Brown, May
And
27,
your date of birth.
1971.
So I wash my hands for 15 seconds. Should it dry? And I verify on my mark the name, Josh Brown, okay, and then May 22nd. Can I check your band?
Sure.
Okay, everything matches my mark. So, do you have any allergies?
No, I don't.
No allergies? Okay, that's good. So today, your blood glucose was 273. So I will be giving you, for your insulin, I'll be giving you 6 units to level it out, okay? And you'll also be getting heparin, which is a anticoagulant. It will decrease the amount of, prevent you from blood clots. You'll also be getting your hepatitis B vaccine. It's just a vaccine to prevent you from getting the hepatitis B. And Lovinex is another anticoagulant, so there's no blood clots. Okay. So for the insulin, I'm going to do that sub-Q on your abdomen. So when you place your skin. Okay, I'm gonna first check that the skin is intact. There's no trauma, inflammation, or any bony prominences. I'm going to wipe the area in a circular motion, allowing it to dry. I'm going to uncap my needle. Since it is sub-Q, we're going to pinch the site. And since it's the abdomen, we're going to make sure it's 2 inches away from the umbilicus. We're going to pinch, inject, and then release. And wait for 10 seconds, release, and then sharps. Okay. Next, we're going to give you heparin, another sub-Q. We're going to do that on your deltoid. For this one, you want to check that it's from the acromion process and have 2 fingers down. So this would be the site. And make sure the skin is intact, no bony prominences, and no trauma or inflammation or lesions. We're going to wipe the site in a circular motion. Let it dry. This is heparin, anticoagulant. I'm going to uncap the needle. Okay. And it is sub-Q, so we are going to pinch, anchor it at a 90-degree, insert, withdraw slowly, and then release at the same angle. Activate sharps. Next, we're gonna give the hepatitis vaccine, and since it is IM for this one, I will do the truncature eventually. So for this one, I'm gonna locate the greater truncature, and then I'm gonna have my heel of my left hand on it since I am right-handed. The hand is gonna go to the umbilicus, and the hand will fit right onto my index pointing to the iliac crest. Spread my fingers right here where there is complete muscle. So for this one, the skin is intact. Wipe it, circular motion. We're gonna give it at a 90 degree. We're gonna stretch the skin, insert, have the needle stable it, inject slowly, wait for 10 seconds, 1, 2, 10, release at same angle, save the device, sharps, place it in sharp spin. And lastly, we have Lovanex with a sub-Q. So for that one, I'm gonna give on the other deltoid. So again, 2 fingers down, the chromium process. Check for any skin lesions or trauma. Skin is intact. Wipe it. Okay. And cut needle. I got it. And then pinch at site. Inject. And then slowly inject it. Release at the same angle. Sharps. And that completes all of our medications for today. Do you have any questions for me?
No.
Are you feeling good?
I'm feeling
Okay. I'm gonna apply bandages for any for the sub-Qs. And if you need any further questions, here's your call light, and I'm gonna go document. Okay, so document. I gave insulin, heparin. So this one I did abdomen, right abdomen. Heparin I did right deltoid. And then for the hep vaccine, I did right ventrogluteal. And then for the Lovanex, I did left deltoid. And now just initial. Initial and initial. And that's it.